Scott Triggers is a valid and reliable tool for assessing risk of pressure injury in surgical patients. Remember that using a risk assessment tool does not replace the need for a comprehensive patient assessment. Do you want to reduce the number of hospital-acquired pressure injuries at your institution? If you answered yes, then you have come to the right place. Join me on a journey through the steps of how to use Scott Triggers and OR skin bundles in the perioperative setting to identify patients at risk for pressure injuries. Keep in mind that this process is only one piece of the larger comprehensive patient assessment. Let's get started. The first step to identifying patients at risk is to conduct a visual skin assessment of your patient, considering skin tone and looking at pressure points in other vulnerable areas, such as the sacrum, heels, elbows, and head. After you complete the visual skin assessment, you should determine the patient's Scott Trigger score. Using the risk assessment tool, answer the following questions. Is the patient 62 years or older? Is the patient's albumin level less than or equal to 3.5 grams per deciliter, or BMI less than 19 or greater than 40? Is the patient's ASA score greater than 3? And will the surgery take more than 3 hours? For every yes, give the patient a point and then add up all the points. If the Scott Trigger score is greater than or equal to 2, your patient is more susceptible to pressure injuries, and you must make a plan to minimize this risk. For the plan, you should follow your institution policy and procedure and implement interventions based on the patient's risk. Preoperative briefing should be used to make the team aware of the patient's positioning risks and needs. Ensure the needed equipment is available. Once you've got your plan, it's time to initiate the OR skin bundle. This includes all the standards for positioning, plus ensuring that all high-risk patients are placed on pressure-reducing support surfaces, and applying prophylactic dressings to bony prominences, such as the sacrum and heels. You should also work with the interdisciplinary pressure injury prevention team to evaluate and select other pressure injury prevention products and positioning aids. Now that your patient is out of surgery, you should conduct a post-op 4-eye visual skin assessment focused on skin integrity, pressure points, and other vulnerable anatomy. The results of this skin assessment should be documented in the medical record and communicated to the healthcare team during handoff. Finally, ensure you have a quality improvement program that monitors the incidence of perioperative pressure injury and uses this as a quality indicator. You should conduct root cause analysis and actions and educate the interdisciplinary staff on pressure injury prevention to ensure competency verification. Now that you know all about how to use Scott Triggers and OR skin bundles, you are ready to prevent hospital-acquired pressure injuries.